Welcome back to Your Health on Morning Express, and today we learn about heart disease. Well, heart disease is difficult enough when it strikes adults, but it can be especially tragic in children. Families have been known to spend all their life savings to get the best care for their children who have heart disease. Many different types of heart problems can affect children. These include congenital heart defects that they are born with, or those they acquire, like rheumatic heart disease. A lot has been done globally for heart diseases, from open heart surgeries, interventional cardiac catheterization, and even heart transplants. Kenyan doctors and hospitals are also doing their bit to catch up and offer relevant solutions to families with children with heart diseases. And that is the focus of Your Health this morning. And to help me in this topic with me is Dr. Victor Ghani. Dr. Ghani is the medical director at the Mater Hospital, and Dr. John Washira, who is a consultant pediatrician and also the treasurer of the Kenya Pediatric Heart Association. And we'll just get right into the discussion. And I'll start with you, Dr. Washira. Broadly, we have heart diseases are congenital, those that children are born with, and those that are acquired, that either from infection or from something else. Could you just, in brief, tell us what these specific heart diseases are, and specifically those that are common within the country?
When we talk about heart diseases, we are mainly looking at many structural problems in the heart, which can either be what a child was born with, congenital, or what a child has acquired, mainly rheumatic heart conditions. The World Health Organization estimates about 50 million children worldwide having heart problems currently. That's like 2 years ago. The Ministry of Health estimates about 500,000 children in this country have a heart problem. Maybe 200,000 of them being congenital, and maybe another similar figure being acquired. That's the figures we're looking at. If we look at the congenital heart diseases, there are many ways of looking at them, but we can basically look at the structure of the heart and say they are either problems affecting the interior wall, those are septal defects, or problems affecting the valves, those are obstructive lesions, or others, and then and others would be the disease affecting the main blood vessels attached to the heart. That's on the structure. That's on mainly on the congenital side of things. On acquired conditions, rheumatic heart disease or acquired conditions are not common worldwide. Unfortunately, they are commoner in that world, and therefore they are neglected. If you open any journal of heart conditions, you won't find much about acquired heart conditions. But if you get one from African origin, you'll find lots of heart problems being acquired. Yeah.
Okay. Dr. Ghani, how would parents suspect or start identifying that their children or their child probably has a heart problem right from birth?
Okay, so different heart problems present at different stages. And perhaps to just simplify the response to the first question, you may find you have a hole in the heart, or you have a problem with one part of the heart not developing the way it should be, or the major blood vessels of the heart going to different areas, and therefore the child lacks oxygen. When this happens, there are symptoms that can appear very early in life. You may find a child has difficulty breastfeeding. They take a few seconds of breastfeeding, then they have to pause, or they turn blue, or you'll notice that the fingers are becoming slightly large, and this may start very early. However, if the heart disease is not very severe, then you will begin to notice changes a bit later in life. And this may happen, at some point you see as if the chest is beating very prominently, the child has to squat, cannot play as usual, there's some delay in the normal milestones, they cannot do what other children can do within specified periods of time. Now, whenever you have this kind of a problem, it's always good to have this checked out. In our facility, we have started a program where even before a child is born, we are able to just take a peek at the heart and just see if there's anything that requires attention.
And actually, that was going to be my next question to both of you. Apart from parents suspecting that their child probably has a heart problem, how do doctors or clinicians then identify or suspect and confirm that this is probably a heart disease? And I'll start with you, Dr. Washira.
The problem with heart diseases is that majority of them have no signs. If you get a child who has got a septal defect, many times the parents can pick nothing on that child. There are many people living in adulthood with no symptoms at all, and they have a heart problem. So that's the biggest problem. So they may be asymptomatic. And then at birth, most of the health workers, when they put a stethoscope at the heart, they may pick a mama. That's, again, very few conditions that will have a mama. Most of the times when they appear...
I'll just pause you there, maybe to our viewers. What is a mama? Okay. Everyone is familiar with the stethoscope that, doctors and nurses put their ears and listen to the chest. When people listen to the chest, there are normal sounds that we hear. One can listen to the normal breath sound, and when at the heart, one will hear the opening and closing of the valves, the so-called lab-dub, heart sound. The normal ones are known by everyone. So when there is an extra heart sound, then medically people call that a mama. Okay. And that means there's an extra heart sound which is coming from an abnormal flow inside the heart. Okay. So that's why it is picked. Mm-hmm. So the third thing, as Dr. Ghani said, is one can pick some bluish color on the lips, usually. Not on the hands, not on the feet early, but usually central early. That can be picked early. The symptoms of parents, people can pick a child who is bleeding rather fast. That can happen with the severe conditions after birth. They may be having rapid breathing or the so-called respiratory distress. And as Dr. Ghani said, when they start breastfeeding, one will notice that they are not feeding well. They are getting tired too easily. And as they grow on, one will realize this child is not gaining weight properly. Let me put a caution that there are many other causes of slow weight gain out there, so it's not only heart problems. The other thing is other developmental milestones. A child may not also develop well when they have got a heart problem. Mm-hmm. And as they go on, then there may be other problems that might occur. Later on, they may have heart failure, and they may have obvious swellings of the hand, of the feet, whatever, that swelling may occur. They may have obvious, they may have obvious abnormal heartbeat. So a child may now be feeling that the heart is beating too fast, or they may even start complaining of chest pain. But rarely do the heart problems cause a chest pain in children. Okay. As we get on to what to do about these problems that they identified, I'd like to inform our viewers that our phone lines are open. You can call in and get in touch with us, and we'll be able to answer your questions and be able to direct your questions to the team of doctors here, the two doctors here, and they'll be able to answer your questions or your comments on this particular topic. And so I'll come to you, Dr. Ghani. When these problems are identified, what options are there to solve these problems?
Mercy, allow me to just respond briefly to the first question on how to pick up these conditions. As Dr. says, a number of people do not have very obvious signs, and we've seen very many children who are treated for pneumonia multiple times, while in fact they have a heart problem. Now, the key thing to assist in delivering good health care to patients with heart disease is to diagnose them early. In the past, in this country, we had a problem where you come, by the time your fingers are swollen, it's extremely late. And even though you're able to get some help, there are some permanent changes that have taken place. And so we are moving towards a program that allows us to identify these children early. And this is by sending people out into the counties to test the children there and pick those with heart disease. And I think the encouragement I want to make to any parent out there is if you find your child is not developing normally, or there are some recurrent illnesses, it's always good, it doesn't harm to have somebody professional take a look at the heart. For the healthcare workers, if you're not sure, if you don't have the equipment, there are options of facilities that can examine a child and tell you definitively that there's a problem. Now, if you were to find a heart problem, there are different options. In this country, we have developed capacity to operate on most children who require surgery. There are those cases that will not require surgery through what we call secondary prevention. We are able to give certain treatments to ensure that they don't develop heart conditions. Perhaps to be clear about this, I'll talk about rheumatic heart disease a little bit more. We have heard of the linkage between a throat illness and heart disease, and this is what is referred to as rheumatic heart disease. You get bacteria in your throat, your body reacts to that, and that reaction causes a problem in your valves. For us to prevent heart problems, the number one, we treat extensively the throat problem. Now, if a child has developed the kind of rheumatic fever that affects the heart, then that child is put on penicillin every single month, and that prevents progression of the disease over time. For the children who are born with heart defects, within this country now we can correct almost all the defects that exist. And we have gone a step further. In the past, for every hole, we had to send a child into theatre, open, take them through a very extensive process. In our facility, we have created a provision where we're able to close almost most holes by a small puncture in the groin. We push up a catheter all the way to where the hole is and then release a small balloon. Within 2 days, the child is able to go home completely cured. And this is capacity that is right here in Kenya. You don't have to go outside of this country to get this kind of care. And of course, without a scar. In the past, we used to bring in very many surgeons from outside, just to treat the simplest conditions. But as of 2015, going on forward, most of the cases that are done by local teams. 73% of all heart surgeries done at our facility were done by local surgeons. And maybe just to tell you how many people you're talking about, in excess of 159 surgeries in 1 year, that is almost one every 2 days, and additional almost 120 children having holes closed in the heart through the cath lab where you deploy a balloon. So these options exist for all children.
Okay. Dr. from your own experience and having worked here in Kenya, what options are there and what do you specifically do for these children?
So as Dr. Ghani said, there are 4 main options. Do nothing for years. There are several defects that don't want to do anything. They will close on their own. Many of them will close by 1.5 years. Then you have got what he alluded, the catheter-based treatment. These are the closed surgeries. They don't need one to open up the chest. The specialist will put in a tube and correct that problem. Then you have got the open heart surgeries. And that is what is now for the complex heart problems. And then we have what is not available here in this country, heart transplant. Those are the 4 main ways of managing it. The biggest problem is, looking at Kenya, Professor Ogendo and Dr. Awori did a research in this country and looked at 5 years, how do we deal with our heart problems? What were their findings? They found that we have late diagnosis. Other than children who can come to Nairobi, we have got less than 10 cardiologists, or less than 15 cardiologists in this country. Where are they? 2 in Mombasa, maybe 2 in Mombasa, 1 in Eldoret, the rest in Nairobi. The rest of the country has got no one to diagnose that. And that's what Dr. Ghani talked about, sending cardiologists out there. So that's one problem. So nothing can be done for those who have not been diagnosed. When we work out in the peripheries, you find children who have been having heart problems forever, and no one has ever diagnosed it. And that's a problem. So that is one of the biggest challenge. Then again, looking at so that study found that many children are diagnosed at about 18 months. That's a bit too late for anything for some of the correctable things. Again, looking at our heart problems that are there, the spectrum is different from what is described in Europe and the other countries. So even when we bring in foreigners to come into our country, they come in unprepared for such sort of problem that we have. And then, as Dr. Ghani said, we operate about the operations are like 200 in 1 year. The Ministry of Health estimates that about 3,000 children need heart surgery every year. So you look at a hospital like Kenyatta, with due respect, the whole of last year, how many did they operate? The machine was down, the doctors were on strike, the health workers were on strike. So you find we have myriads of problems as a country. And all these conditions, most of the heart conditions are treatable. And as Dr. Ghani said, they are preventable. If you look at the rheumatic heart diseases. So we have a correctable problem, preventable problem, but it's still a big problem in the country.
Okay. I'd want us to look into the issue of capacity and what we can do as a country, and probably capacity contributes to the late diagnosis. But before that, I'd like us to engage Lucy Werimo from Malaba. She's calling in, and I'd like us to listen to her. Good morning, Lucy.
I'm okay.
Yes, Lucy, we can hear you. Go ahead with your question or comment.
About the heart.
Lucy, if you could just reduce the volume on your TV so that we can hear you clearly.
I'm asking about the
Lucy, please reduce the volume on your TV so that we can hear you.
I'm asking. Heart disease are newborn child.
Okay, Lucy, we'll take your call again in a few minutes. We'll get back to the discussion and then we'll get back to Lucy when we can clearly get what she's asking. And I'll come to you, gentlemen, on the issue of capacity, probably towards contributing to late diagnosis. And we know public health sector has its own myriad of problems, and the private health sector probably has its own other issues in terms of cost and whatnot. So what options do Kenyans have?
Well, as Dr. Wachira has rightly stated, our problem as a country to a large extent has been distribution of health workforce. Within Nairobi, to a large extent, we can say that we have built significant capacity to address most of the issues that are faced. But that's very different from almost any other county in this country. I know there are many public facilities that are trying to do something about heart disease. I know Mombasa County, the General Hospital, has a nascent program, as well as MTRH, Kenyatta. But for us to do something meaningful, it has to be a concerted effort, and we have to have many more doctors. Certainly, the need to be sending people out of the country has reduced significantly. As I had stated before, the various options available, primary prevention, secondary prevention, diagnosis, that capacity is within the country, but not equally distributed. I would recommend a program where we train many young doctors to do what is called a PEEP echo, where they take the machine, the ultrasound for the heart, and they're able to see certain small defects. Of course, for the more complicated cases, then they're able to refer to cardiologists. Again, the rotation program where you send cardiologists out from Nairobi periodically to the respective counties, that approach really helps, because most of those areas, there are very many children with heart disease, but nobody will diagnose them until the day the cardiologist goes there. And you'll be surprised. You'll find a child who's missed school for 3 years, has not gone to school consistently, but it's a heart problem that takes about 2 days to resolve. And picking them up is the biggest problem that we have at this stage.
Yeah. Dr. Wachira, is it a problem of human resource only, the number of doctors or specialized nurses that we have, or is there another capacity issue that we have as a country?
Okay, looking at the capacity, Kenya has made big progress, as Dr. Ghani is saying, but it's a drop in the ocean. If you look at a country of 40 billion with 15 cardiologists, pediatric cardiologists, you're talking about 1 cardiologist for 3 million Kenyans, pediatric cardiologists. You're talking about 10 cardiothoracic surgeons. You're talking about 1 cardiothoracic for 10 million Kenyans, 4 million Kenyans. So there is the human resources. As there is need, World Health Organization has figures that are given to the government. How many, for this population, how many cardiologists do you need for the children? How many cardiothoracics do you need for this country? And we are far from that. So that is the human resources. If you look at a typical heart surgery, it requires like 10 specialists. You have the cardiologist, you have the surgeon, you have anesthetist, you have the nurses, you have the perfusionist, you have the nutritionist. So you have a whole big team, which we actually have if you look at how many ICUs in Kenya can handle a heart surgery, less than 10. So there is the issue of human resources. We have the specialist, lack of specialists. We have lack of facilities. How many ICUs or theaters can do a heart-lung machine? So we have problem of facilities. Again, we have got inappropriate, allocation of you can say, of resources. If you look at our healthcare systems, the way it is structured, we have a significant problem, probably with no resources. If you look at counties, 47 counties in this country, how many of them have invested in an echo machine or any way of diagnosing these heart problems? So we have inappropriate allocation of the billions of shillings that are, that are going out to the counties. Mm-hmm. So in terms of capacity, it's a challenge, and probably needs to be looked at properly from all corners.
Okay.
Yeah. Maybe I may add one significant challenge, of course, is the cost of care. It's extremely expensive.
I'll just hold that thought. I will specifically come to it because I want us to listen in to a caller from Kitale. That's Diego Thomas. Good morning, Thomas.
I'm fine.
I can hear you. Go ahead with your question or comment to the panel.
Okay, thank you. I heard a son, eh? I'm fine, madam.
Okay, good morning. Go ahead, Thomas.
I had a son,
Yes.
who is 12 years old. He was operated on Kenyatta Hospital when he was 4 years. He had, not 4 years, 4 months. He had a problem with pulse of blood to the heart. So now, he's 12 years.
Go ahead, Thomas.
Now, ako na shida sana na masomo. Alafu hajakura mzuri. He had problem with learning,
With learning?
Wait.
Okay, just reduce the volume of your TV a bit so that we can we can hear you clearly.
Okay, can I go ahead?
Yes, just ask your question now.
So, alifanyiwa operation akiwa 4 months. Alafu ameguro ako na shida ya masomo sana. Walikuwa wamesema hiyo nini yake ya kupika hiyo valve yake ya kutuma nini damu iende kwa roho ilikuwa iko weak. Akafanyiwa operation. So now ako na shida ya masomo sana. Then swali ya pili nilikuwa nauliza kama naweza pata wapi mahali yenye anaweza angaliwa tena.
Okay, thank you, Thomas, for your question, and I'll throw that question to the both of you gentlemen. So his son was operated at Kenyatta at 4 months old. Now he's 12, and the young boy has learning difficulties or learning problems. Is this something that is expected? And his other question is, where can he get a second evaluation for his son? I'll start with you, Ghani, then Dr. Ashira.
Yes, normally what from that case is the learning difficulty relates to just the ability to attend school regularly like other children, and perhaps challenges with the physical performance, which can result in challenges as well with the academic performance if you can't attend school regularly and be at the same pace and same place as the children. My recommendation and suggestion to this parent is to have the child assessed again by a cardiologist. He is in Kitale, so the nearest facility there would be Moi Teaching and Referral Hospital, but also if he has the resources, he can come all the way to the Mater Hospital and be able to review the child and just advise on the next steps. Now, once the cardiac issue has been resolved, or if if there are alternatives that exist, then we can go ahead and implement that. If not, then we can also assess other potential healthcare issues that the child may have.
Okay,
Yeah.
Dr. Ashira, anything you may want to add to what Dr. Ghani has for Thomas Yeko?
One is that 4 months is most likely a congenital heart disease that he had, and we don't know the details. He has the options of going back to where he was operated, that's still Kenyatta, or go to Moi Teaching Referral Hospital. There is a cardiologist there, there's a team there that can assess him. This weekend at the MP Shah Hospital, there is screening going on for free treatment, for free surgeries. He can actually come on Friday or Saturday, and he can be assessed. And any other child out there with a heart problem.
Mm-hmm. Okay, let's take our second caller from Eldoret, and this is Gilbert Leonard. Good morning, Gilbert.
Good morning, Mazi.
So go ahead with your question or comment for the team of doctors this morning.
Okay, thank you very much. I was a patient, or I was diagnosed with rheumatic heart disease when I was 5 years old. Then I was put under treatment, this Panada injection for almost 11 years. Then currently I'm 32 years old. Then I developed this condition of high blood pressure last year or 2015. Then currently I'm in medication for hypertension, but last week I went to Memorial, that is in MCRH, for further diagnosis. Then they did an echo. Then for unknown reason, the doctor could not connect the possibility of me when I was young with rheumatic heart disease and this hypertension currently. Now, I was trying to ask the panelists or doctors if there is any connection between the two. That is hypertension now and rheumatic heart disease while I was a kid.
Okay, thank you, Gilbert. You say you're 23 or 33?
No, currently I'm 32.
Okay. Okay, thank you very much for your question. The team of doctors will just answer that now. Is there a link between his rheumatic heart disease diagnosis when he was 5 and now he's 32 years old with high blood pressure? I'll start with you, Dr. Wachira.
Okay, most hypertension, high blood pressure occurs after that 5 years. So when you find it occurring early, there might be some problems that could be, bring it about. And the fact that he had a heart problem early could be playing a role. That's a simple way of looking at it. Majority of people with high blood pressure, they have no risk factors. They have no heart problem. So it is a yes or no. I mean, we can't say for true that the rheumatic heart disease is causing the hypertension. It could just be a risk factor for other heart problems later on in life.
Okay. Thank you, Dr. Ghani?
Yes, before I could answer him very directly, I think just hearing what he has said, his history, he had an echo done recently. The echo did not quite pick any abnormality in the heart, and that suggests that perhaps the secondary prevention he underwent for 11 years could have been successful in preventing heart disease. It's possible for people with heart disease to get other complications unrelated to the primary heart problem. And this could very well be the case for this particular person. My suggestion would be to have a complete evaluation for hypertension as a whole, and then have perhaps a second opinion concerning the status of the heart. If the echo was indeed normal, it suggests that he may not have progressed into significant heart disease. Rheumatic heart disease primarily affects the valves and affects the flow and affects the chambers physically of the heart. It's not common for it to extend into the blood vessels and cause high blood pressure. Okay. Yeah.
Now, my final, thank you very much. And thank you for getting in touch with us on phone. Now, my final question to the two of you is that heart surgeries, dealing with heart disease or managing is quite costly. Why is this the case? And you had started your comments on this, Dr. Ghani.
Yes, number one, as a country, we don't manufacture anything, and we should. We import everything that we need to use in these surgeries and any procedure. The devices I've told you about, that simple balloon can cost as much as 200,000, just that device alone to put it in. And we're going to do it in a very expensive machine called a cath lab. If you require heart surgery, you're going to be on the heart-lung machine, and the items used are extremely expensive. Dr. Wachira reported to you the number of people who need to be there. And after surgery, it's mandatory you're in an ICU setting. That is also a very expensive resource. So in general, dealing with one cardiac case is extremely expensive. And it's not just at that point of treatment. The preparation before and the aftercare, these parents need a lot of support. And indeed, perhaps this is the time I need to give thanks to all those who've supported us in the Matter Heart Run, because the 3,000 plus cases we've done as a facility has been largely thanks to the well-wishers who've participated in these heart runs. Yeah.
Okay. Dr. Wachira, anything to add on what Ghani has said on why it is costly to manage these heart diseases?
I think he has captured it very well. The human resources is expensive. You need a whole team, maybe about 10 different specialists to be present. The equipments are expensive. And again, many patients are coming in late, so also complex. And and hospitals again are not allocating resources. The MP Shah Hospital is now allocating a huge budget to giving free treatment the whole of next week, starting from this weekend. Any child out there with a heart problem can come in for screening on Friday or this Saturday and get free screening and then get free treatment if they qualify for that. They are partnering with a team from abroad. Countrywide, we have been having foreign missions coming in and partnering with any of the hospitals, whether it's Karen, Nairobi Hospital, Kenyatta, Mata, MP Shah, and then now they reduce the cost of that. So we rely a lot on donors and other funding, and even the NHIF currently is funding a part of those costs. So what we need is more and more, lobbying for more money to come into heart problems, because it is treatable, it's preventable.
Okay, your final comment in 30 seconds on this issue of heart disease.
The heart disease. I think there's an opportunity this week. Next week, as I said, the Pisha Hospital is over that. So I think I would want as many people as possible to benefit from that. But away from that, let's all prevent heart problems.
Okay.
And let's have early diagnosis. Anybody who suspects they have a heart problem, go out for the diagnosis. And then the health workers, be more vigilant and pick as many heart problems and refer them appropriately.
Okay, thank you. Dr. Ghani, your final comments?
Heart disease does not select somebody based on socioeconomic status. In fact, acquired heart disease, rheumatic heart disease, affects persons who don't have great access to health care. Given the cost of care, it's extremely expensive, and many families that need it can't have it. The only way to link these people to care is through well-wishers who come into programs like the Heart Run to support. And it's been tremendous. If you see the stories of lives that have been changed, a child who had no chance, an orphan child living with grandparents in a shack somewhere in Turkana, having the opportunity to go to school or to kick a ball because a well-wisher somewhere said, let's come together, let's give this child a chance. It really works. Now, my appeal would be for us not to tire from supporting this. We have capacity within this country to give most of the children who need it care. As a facility, our request is to join us in our Matter Heart Run on the 26th of May this year and see if we can raise more funds for more children and touch many children's hearts.
Thank you very much, and thank you very much, gentlemen, for joining me this morning. We have been speaking to Dr. Victor Ghani, who is the medical director at the Mater Hospital, and Dr. John Washiro is a consultant pediatrician and the treasurer of Kenya Pediatric Association on childhood heart disease. And what we have learned today is that they are manageable, they are treatable, they are preventable, and 73% of the heart problems in Kenya can actually or have actually been managed in Kenya. And that was our topic on Your Health today with me, Dr. Mercy Korir. Join me again next Wednesday from 8 to 9 on Morning Express as we explore another topic on your health. I'll hand you over back to Mike Kitonga.
Thank you very much.